This is you, a medical professional. You have your own personal ethics and motivations, an individual understanding of culture and distinctive biases, and a large understanding of medicine and the incorporation of evidence in your practice. This is your patient. They have their own culture and personal experience, and the biases that go along with this. This means all patients will have a very different view of illness and the medical professions that assist them. The interactions that you have with your patients and the medical outcomes of these interactions are dependent on each of these factors.
We would like to help you improve your interactions with patients to improve the overall outcomes by dealing with these factors holistically. To do this, we would like to introduce the explanatory model. Firstly, culture is defined as a complex whole which includes knowledge, beliefs, arts, morals, laws, customs, and any other capabilities and habits acquired by man as a member of society. Culture governs the behavior of everyone, and these factors are crucial for diagnosis, treatment, and care of patients. For patients and clinicians, they help shape health-related beliefs, behaviors, and values.
The explanatory model uses simple questions to give medical professionals a critical insight into what is most important to the patient. This includes the patient's cultural biases and understanding of illness, including their understanding of the disease and treatment. For example, what caused my sickness? Why did I become sick at this time? How does the illness affect my body? What will happen to me? And how should this illness be treated? These questions give medical professionals an insight into the behavioral psychology of the patient. Behavioral psychology involves the consideration of one's actions with their thoughts and emotions. This is evident in the explanatory model as the patient's actions and emotions will influence their answers and in turn the diagnosis the doctor makes.
The explanatory model presents many advantages for you and your practice. This involves creating a better understanding of cultural stigmas and how these affect treatments. We can see this through the terminology of certain medical conditions. For instance, the diagnosis of mental health conditions using the terms such as anxiety disorder and depressive disorder. These terms are not used in Chinese cultures. Instead, the terms neurasthenia and stress-related condition are used. In this culture, terminology such as depression and anxiety are treated with a very large stigma.
It is information like this that can be gained through the explanatory model. Without such information, the way in which the patient responds to such terminology can be detrimental to their treatment. This could affect how the patient not only approaches the treatment, but also their willingness to receive treatment. Through implementing the explanatory approach, we guarantee that you will be able to avoid these cultural stigmas and present your patient with the best care possible.